Hello, I'm Dr. Asha Patel, clinical psychologist and founder of Innovating Minds. I'm here to share with you our learnings, our understandings, and the learnings from local authorities that have embedded trauma-informed interventions to support children and young people affected by domestic abuse. The aim of this presentation is to support and develop your knowledge around understanding domestic abuse and the impact on children and young people, and particularly from a trauma-informed approach. And hopefully it'll also give you some reassurance as well in terms of the knowledge and experience that you already have. We'll then move on to some commissioning principles and walk through what does trauma-informed practice look like, how can you commission services and programs that align with already your existing pathways for support, and then finishing on how you can progress forward and some things that you might want to take into consideration too. Now, when we think about trauma-informed practice, it's really important that we have a shared definition of what do we mean by trauma. We know that trauma-informed practice is becoming quite a buzzword, and therefore I'm really keen just to help you on this journey around being able to understand what do we mean by trauma-informed practice, what do we mean by trauma, and how do we know if interventions that we're looking to commission are actually trauma-informed. So what we do know is actually trauma can be many things. It can be something that a child has experienced as a one-off event, or it could be ongoing repetitive experiences. But also it might be things that a child hasn't had. So it might be that their needs have not been met by primary caregivers. It might be actually that they've not felt the warmth. It might be that their needs have not been attuned to. Now, when we think about trauma, it's often us as adults that starts to put things into a hierarchy. But what it is important to remember that it's always the child's experience that defines their trauma. And therefore, if we think about children that are affected by domestic abuse, it's really important that we think about their experiences as opposed to ours. So we might think, well, actually, they're no longer living with the adult that harms, or it happened a long time ago. So you might be working with older children that experienced domestic abuse when there was maybe a baby or a toddler. And then we're thinking, well, surely they're still not being impacted. But it's really important to think about trauma as a child's experience and not as us as adults that think that actually there's certain things that need to be in place, or maybe they should have grown out of it. Now, what we know from the neuroscience and relational based approaches is that actually trauma is stored as sensory memories and it impacts a child's nervous system. Now, what do we mean by that, and why am I sharing this with you? So often we might commission interventions that support children to talk about their experiences. And we think by getting children to talk about their experiences, what they've lived through, what they've seen, what they've had to engage in, will help them process the trauma. But that is taking a real cognitive approach. And actually what we know is trauma isn't processed through cognitive-based approaches, such as talking therapy. What we do know is trauma is stored in the nervous system as sensory memories. So it might be, for example, the child's at school and a teacher is walking past them, walking by them, it might be walking behind them, and the child's body is picking up on that somebody's close behind me. And that can trigger them and causing the child, it might be that they react in a way that we as the adults seems a little bit unreasonable, that the child leaves the classroom, or they might start to verbalise that they're not happy about that in a way that we find as the adult as quite aggressive. Now, it's really important why we think about this from a point of domestic abuse is remember that children that have experienced domestic abuse, their body will be there to keep them safe and to protect them. So it'll be hypervigilant. It'll be storing those memories that they've experienced in their body, because the next time that they might experience those things taking place, whether it's in the household or outside. Their body is keeping those memories just in case it needs them to protect them and keep them safe. So that's perceived threat. So even though that child might not be in an actual threatening environment, the body is holding on to these memories, and just in case there's perceived threat taking place, so it can flick into safety survival mode. Now, the reason why this is really important, because when you're thinking about commissioning services for children, adopting a body-based approach to supporting children and young people will help them process the trauma and support their healing journey. Services that ask children to talk about their experiences, relive them, will actually be re-traumatising for them and further cause additional difficulties for that young person. So body-based strategies that support children to learn about how their body and brain are working together and what happens when their body and brain is feeling safe and unsafe. This also helps children because they start to learn that actually there's not something wrong with them, that this is a response to their body and brain feeling safe or unsafe. Now, something we get asked a lot from commissioners, and it's really great to see that commissioners are also developing their knowledge and insight into understanding, well, what does a trauma-informed intervention look like? So a trauma-informed intervention really focuses on the neuroscience and relational-based approaches. It really looks at how do we support connection? How do we offer children moments of co-regulation that we can help a child to feel safe in the moment with us, that they can be then open up to learning and understanding and using different strategies to help them process those sensory memories. Now, a relational-based approach puts the relationship with the frontline practitioner at the forefront. So actually, the practitioner becomes the biggest resource for the child. So it's no longer that we're doing something to the child, we're doing it with them, with the frontline practitioner. Now, it's really important that the frontline practitioner has some awareness around how do their body and brain feel, how they're feeling in that moment, are they feeling dysregulated, are they feeling quite overwhelmed, are they actually thinking about the next session that they've got or other things that are taking priority? Because if they are, that will affect how they will be able to engage with them. So training that understands and integrates neuroscience and relational-based approaches is really important. Now, trauma-informed interventions, it's really important to think about how do we avoid re-traumatisation. Often children and families have not had a great experience of being able to access help. They might have already had a number of health professionals and social professionals that have been coming into their home or that they've been involved with that haven't been pleasant. So already their experiences, the help-seeking experience has not been so great. And we want to change that. We want to provide them that positive help-seeking experience so they come back and seek support, because that will also affect how they seek support in their future. So we really want to make sure that any interventions, any services that are commissioned avoid re-traumatisation, which often means not asking children to relive their experiences of domestic abuse. So we don't want frontline practitioners poking around in tell me what happened, what did you see, which parent, how do you feel about that in terms of particular parents, because we have seen it ourselves where children have been traumatised through sessions that were supposed to be there to support them. And that's because they've been asked to relive, which has resurfaced those sensory memories, and they've not had the ability to be able to process them. Now, if you also think about the delivery, we also need to be thinking about how flexible and how can we make it safe for children to be able to access. Which means how do we meet the children and the families in their space, a space that they feel comfortable with? Can it be offered on a group basis, on a one-to-one? Can it be in their own space? So actually, can they, if they're already have a great relationship, whether it's somebody within a school, somebody within early help, how can they get and access support through those people that they already have trusted relationships with, and in a space they already feel safe in terms of the physical environment? So how can we create some flexibility in the delivery? Now, inclusive and accessibility is really important. We know that there's a high number of children and families that experience domestic abuse that have got special educational needs, that have disabilities, that are ethnic minorities. And really, therefore, it's really important that we think about how can we meet those needs? How do we meet the needs of children with neurodiversity? How can we support families that are maybe from that have English as an additional language? How do we engage parents and carers so actually they feel like they're engaging in an intervention that is inclusive, that is accessible, that they can relate to in terms of the images that they see, the characters that they interact with? And the most of all as well is it evidence-based? How do you check in terms of if an intervention is evidence-based? What do you look for? Has the evidence base been published to a peer-reviewed journal article? Has it got case studies from other local authorities that are embedding the service and intervention that you're looking into? Now, evidence base is really important as well, because is really important is to know that actually, is what you're commissioning working? Is it doing what we think it's doing? How can we learn from the way it's being commissioned, the way it's being integrated? And therefore, that also fits into the flexibility. Can a commission service, a program that you embed, integrate into your existing systems? Because actually what we don't want to do is create more layers. We want it to make it as streamlined as possible, because that'll have a massive impact on people being able to access the help and support that we want them to, and at the earliest possible point as well. And this is why it's important to really think about, when you are looking to commission services for children affected by domestic abuse, is how accessible and how scalable is this? We know that children are seen as victims of domestic abuse, and this is not a fad, this is an ongoing commitment, it's a part of the bill. So actually, you have a great opportunity to now be thinking about actually how do you integrate systems, how do you integrate interventions that are accessible and scalable? How can you train the existing workforce? Do you actually need specialist domestic abuse services to be able to offer this early intervention and support? Is it that we can train the frontline practitioners that already have these relationships with children, with babies, with young people, with parents and carers? Can we train those, actually, the existing workforce, to implement trauma-informed interventions? And then actually, if children and families do need specialist support from domestic abuse services, they actually have the capacity to be able to support those children and families on a longer term basis. Now, I'm going to give you some examples. So, for example, Warrington has integrated the Healing Together programme, and they've integrated it as part of their Tier 1 service. Now, the Healing Together programme upskills frontline practitioners working across education, health and social care. And these are frontline practitioners that are not clinically trained, but do have interactions, therapeutic interactions with children and families. They are amazing at building therapeutic relationships with them. So we're upskilling them to become Healing Together facilitators, so they can become trauma-informed practitioners. They can deliver the Healing Together programme on a one-to-one basis, on a group basis, and it's 6 sessions. So it can be delivered quite flexibly. It can take between 15 minutes to 45 minutes for each session to take place. But Warrington has embedded the Healing Together programme by training frontline practitioners in their early help team, but also within schools. So when a young person has been identified as being a victim of domestic abuse, they can access early help. They don't need to be referred through social care and specialist services to be able to access early trauma-informed help. Now, they've seen some great impact taking place where children have been able to engage in their learning. They've seen an improvement in their mental health and well-being. They've seen improvements in relationships within the household, whether it's child to parent or siblings. So that is just one example. Manchester City Council has trained their early help workers, and what they've done is really think about actually, by training their early health workers, the line manager has been able to cascade case loads in terms of families that they're working with to the Healing Together practitioners. Now, really interestingly, Manchester saw a reduction in children, preventing children going into care. So children that was on the edge of care were actually able to move back with their family. They also saw that the frontline practitioners now more interested and had the confidence and the skills to work directly with children and families via the Healing Together programme. Now, Kent Family Hubs, what they have done is integrated it as a part of their core offer. It's been approved by the Cabinet, and Kent Family Hubs recognise that actually, although the Family Hubs job is to signpost families and children to external services, they recognise that there isn't really any services out there to signpost to. So their frontline practitioners in the Family Hubs are trained to deliver the Healing Together programme. They offer it on a group basis and on a one-to-one basis for those children with special educational needs. They might have learning difficulties, they also might have hearing difficulties, and the Healing Together programme is translated into Bengali, Polish, Arabic, but it also includes British Sign Language as well to support children and families that have hearing difficulties. So all those local authorities have been on this journey to think, how does the Healing Together programme integrate into our existing systems? How does it align with frontline practitioners in terms of referral pathways and front door services to enable more children and more families to access the help? It also really integrates really well with the new social care reforms that are taking place in children's social care. And this importance that's placed upon early intervention and prevention. So they've seen actually how the Healing Together programme can be a way of offering this accessible and scalable support for children affected by domestic abuse. Now, one thing for you to think about when you're thinking about whether you commission the Healing Together programme or some other intervention or service that's out there, how does this align with the system, with the culture of the service that you're operating in? So you really have to think about your current frontline practice and the culture of the service. If the current frontline practice is more punitive-based approaches, it's more maybe parenting of using behaviour-based approaches, then actually trauma-informed practice doesn't align really well with those. So if you have got frontline practitioners that may be not on the journey of trauma-informed practice and very keen to maybe implement more behaviour-based approaches, more maybe punitive consequence-based approaches, then this trauma-informed practice won't align with that approach. So it's also really important to think about, where are your frontline practitioners on this journey? Can they be brought on this journey? Are you still at the really early days? And then thinking about the culture of your service. How flexible is it? How reflective is it? How open is it to be able to embed trauma-informed interventions using the existing workforce? How likely is it that they're able to work in partnership with each other? And really think about actually, how can we work with external organisations, whether it's voluntary community service, it's health, how can we align these services together to work in partnership? And then really thinking about your strategy, whether it's your domestic abuse strategy, whether it's your safer community strategy, your children's social care strategy, all those strategies that you're aware of and that you're working with your colleagues, how does this align with that? Do you have things in your strategy around being able to children affected by domestic abuse being able to access their own help and support? Do you have an action point that talks about being able to access support a lot quicker instead of being referred to external services and then discharged because they've not attended or they don't meet thresholds? And then really thinking about the longer term impact. Where do you see your strategy? Now, in some local authorities, actually, the Healing Together programme is really embedded. So Camden, for example, they're embedding it into the education system, early health team and family hubs, that it's just become a part impact of the language, that the staff know, that they go through the training, and they continue to access that ongoing support through Innovating Minds. So what long-term impact do you want to see, and how can you measure that? Now, your current commission services, how does the trauma-informed intervention, maybe how does the Healing Together programme align with your current commission services? Now, this is a lot of work that I get involved in, because I think it's really important that your current commission services are able to understand the service that is being brought in, the service that is being commissioned, so they can also work alongside frontline practitioners, or when they're receiving referrals, are they aware that actually this young person's already completed the Healing Together programme, and therefore do they currently need the commission service, or do they not need it anymore, which is great, because then that builds capacity and creates capacity for those children and families that do need that specialist commission service. And then really thinking about the trauma-informed training. Hear so many times that we've already done trauma-informed training, we've done one day, we've done half a day, we're trauma-informed. Now, it's really important that you give your staff the opportunity to go through different experience of trauma-informed training, because things will land very differently, trainers are trained very differently, and actually to build on that knowledge and their experience, they need to have it in different formats, but also need to be focused on them as a trauma-informed practitioner. What does it look like in practice? So they've got the confidence to be able to go away and embed trauma-informed principles into their work. What we know from the data from the Healing Together programme, that is actually 95% of frontline practitioners start to then embed trauma-informed principles into the rest of their work. So even if they're not delivering the Healing Together programme, they actually have the confidence and the skill set to be able to embed the principles. And that's because they're provided the resources. For me, it's no good that we ask frontline practitioners to go into trauma-informed training and then don't give them the resources to be able to embed that. Because the Healing Together programme comes with lots of resources, so that's a manual, that's a worksheet, the video animations, to take them through each session, so we can develop the practitioner's confidence and understanding, so actually they're learning themselves whilst delivering the programme to the children and young people. Now, commitment is really important. It's no good that you invest in trauma-informed intervention to support children affected by domestic abuse and then actually it doesn't get embedded. That's not great for us, that's not great for you, and it's definitely not great for children and families. So it's really important that we think about that line management commitment and that senior leadership team commitment, making sure that they're committed to their team attending the training. So from Healing Together, we have 2 days of core training that's delivered online, and then the practitioners access specialist training to be able to really think about how do they understand the impact of domestic abuse on children and parents? How do they work with parents and carers and resource them to be able to support their children affected by domestic abuse? And if they're doing the direct work with the children, how do they understand the impact of domestic abuse on children, and how can they work with them? So investing in that training and progress is really important, because actually without the training, your practitioners cannot confidently go on to implement interventions like the Healing Together programme. Now, allocation of families to Healing Together facilitators is really important. And one, because it actually gives the practitioners the ability to embed their training. And the more times that they deliver interventions like the Healing Together programme, then actually they start to feel more confident with it. They start to get their own ways of introducing the sessions. And the more times that they deliver it, actually they start to learn from themselves in terms of the impact that they see on the children. So how can families be allocated to frontline practitioners that are trained in interventions to be able to deliver, so they can actually utilise those skills, and so children and families can access early trauma-informed help? And then also really important to think about the line management supervision that is taking place. Is the line manager aware of what the intervention, what the commission service looks like, so that they can provide supervision and support to that frontline practitioner as well? Now, how can you move forward? And I think this is really important because often we get stuck in, okay, I know there's this gap in service, but what do I do about it? So really start off by identifying your gaps in service, and I'm pretty sure you know what those gaps are. And then really think about identifying interventions that can meet your needs. So alongside the Healing Together program, you might be looking what else is out there and really thinking about, does the intervention that you're looking to explore, can it be delivered flexibly? Can it be delivered on a one-to-one basis, on a group basis? Is it translated into different languages? Is it suitable for children with hearing difficulties, with special educational needs, with neurodiverse needs? What is it about your population that you're trying to serve? Who is it that you know from the data that you've got that needs to access the help? How can you identify teams and services that can already embrace a training and implementation? It's always great to start off with people that get it and understand it and can become champions of it, because they can be your like test and learn site. So really thinking about, okay, let's start off here in this service and then grow it. And if you're thinking about actually how do we engage education as well, because we also know that that's a great opportunity, particularly with the Operation Encompass notifications, it's really then thinking about which schools can support that, because you'll have loads of schools that you can think straight away that great, they'll embed this, they'll embrace it. There'll be other schools that actually they need this, but they're not so great in terms of the engagement or the commitment and the motivation to engage, but actually it's maybe sometimes those schools that need it the most. And often those schools come on board when they start to see the impact and start to recognise how it can support children, how it can support children to feel more safe and regulated. So actually they're not displaying behaviours that challenge, that they're actually borrowing the nervous system of a frontline practitioner, because that practitioner is able to be calm, safe and grounded as an adult. How do you monitor impact and feedback? Is the organisation, the service actually a part of the evidence-based practice and collecting data? So with the Healing Together programme at Innovating Minds, the frontline practitioners upload pre and post measures. We use the emotional awareness questionnaire because it's a valid and reliable tool. But also practitioners will also upload case studies as well. Now that helps us to gain a deeper knowledge and understanding in terms of the impact of the intervention, because sometimes a questionnaire just doesn't quite capture that information. And that feedback, that impact has shown that actually how the programme has supported a reduction in child-to-parent violence. There's been an unintended consequence where children are self-regulating, because the programme's aim is not to get children to self-regulate, it's actually for children to experience co-regulation. But because they've had such a great experience, they actually go on to using the tools that they've learned in the programme themselves. And then really important as well is, how can we increase reach? How can we make it more accessible for children and families? What we've seen through the Healing Together programme, because we're training frontline practitioners that already have those relationships, that actually local authorities are reaching children from ethnic minorities that typically haven't been really willing or feeling safe enough to engage with services. Then they've engaged with the Healing Together programme and then reached out and said, hey, do you have anything else that's available for my children to access? We've seen children and families actually been able to live together again and move closer, or reduce the risk of being at the edge of care or moving into care. We've seen the Healing Together programme in children's homes, where actually children are able to go back home and live with their biological parents again. So it's really important for you to think about, how can you move forward? How can you use innovation? How can you use more scalable and accessible ways to support children that are affected by domestic abuse? Now, if this is something that you're really interested in and just want to talk things through, do scan this QR code that's on the screen and arrange to book a meeting with me. It's always my pleasure to be able to support you on this journey, even if it's not the Healing Together programme that you decide to commission, but support you on this journey to really think about embedding trauma-informed practice for children and young people that are affected by domestic abuse. Thank you.